Unit 1, Psychology's History and Approaches. Psychology is the scientific study of thought and behavior. There are many approaches to psychology: biological, behavioral, cognitive, and psychodynamic. Unit 2, Research Method. Studies must have reliability and validity. There are two types of studies: correlation study and experiment. Unit 3, Biological Basis of Behavior. The nervous system receives and transmits information. There are two types of nervous systems: central and peripheral. Neurons are the basic unit of the nervous system. There are three main parts: soma, dendrite, and axon. Information exchange is neurons communicating by receiving and transmitting nerve impulses. The endocrine system is made up of hormone-secreting glands, affects communication inside the body.
Unit 4 is Sensation and Perception. There's different parts of the eye: the cornea, lens, retina, and optic nerve. There are also different parts of the ear: the outer ear, eardrum, oval window, cochlea, hair, and hair cells. For vision, light waves enter through the eye, and for audition, sound waves enter through the ear. Sound waves can be vibrations that stimulate through auditory receptors. Sound waves can have different amplitude and frequency. Amplitude is the height of the wave, and frequency is the length of the wave. To move on to sensation and perception, we can talk about measuring perception. You can measure it through absolute threshold, the just noticeable difference, and Weber's law. According to Gestalt's rules, we can group things in different ways. We can group things through proximity, similarity, continuity, closure, and common fate. There are also different ways to processing, bottom up and top down. To move on to Unit 5, we have different levels of consciousness: conscious, preconscious, non-conscious, and unconscious. We also have different types of drugs: stimulants, depressants, opioids, and hallucinogens. And we also have different stages of sleep: light sleep, deeper sleep, delta waves, deepest type of sleep, and REM sleep occurs. Unit 6 is learning. There are two types of learning: classical conditioning and operant conditioning. In classical conditioning, we have the unconditioned stimulus, the unconditioned response, and the conditioned response and stimulus. In operant conditioning, we have the reinforcer and punisher, and we have different schedules. So we have fixed, variable, fixed ratio, and variable ratio. The reinforcer is something that increases the likelihood of a behavior, and the punisher is something that decreases the likelihood of a behavior. To move on, we'll talk about Unit 7. Memory refers to the way we record events, information, and skills. Memory has encoding, storage, and retrieval. We have different types of memory systems: sensory memory, short-term memory, and long-term memory. We also have different ways of forgetting: decay, displacement, recall, task findings, reconstructive nature of memory, interference, and types of amnesia. There are two types of amnesia: anterograde amnesia, which is when a patient cannot form new memories after brain injury, and retrograde amnesia, which is when a patient cannot remember events prior to brain injury.
Unit 8, Motivation and Emotion. Motivation refers to the process of acting to satisfy a goal. Biological reasons for motivation, social reasons for motivation, motivation theories. Emotion involves physical and cognitive arousal and affects motivation. James Lang theory, Cannon-Barth theory, and Singer theory. Stress involves a physical and physiological reason to an event or change. First to both events, stressors, and how we react to changes. Personality types affect how people respond to stress. Type A personality, stress triggers hostility, anger, competitiveness, and there is a higher heart disease risk. Type B personality copes well with stress and is easygoing.
Unit 9, Developmental Psychology. Development refers to the way in which humans grow and change over the course of their lives. Physical development has three: infant stage, adolescence, and aging. Social development is the growth in how one relates to others. There are three types of attachment: secure attachment, resistant attachment, and avoidant attachment. Cognitive development refers to an individual's intellectual growth from infancy to adulthood. Unit 10, Personality. Personality refers to the behaviors, attitudes, and emotions that characterize an individual. There are 5 different types of approaches. Trait approach emphasizes underlying traits. Behavioral cognitive approach emphasizes environment and situations. Psychodynamic approach: personality differences arise from unconscious and conflicts and desires. Humanistic approach focus on whether people achieve their potential. Unit 11, Testing and individual differences. There are Different ways of measuring intelligence. Intelligence quotient, Stanford Binet scale, and Wechsler adult scale.
Unit 12, Abnormal Psychology. There are 5 ways to define abnormality. The condition is considered abnormal in the person's culture. The condition causes personal distress to the subject. The condition prevents functional living in society. The condition makes the person a danger to themselves or others. The condition calls into question a person's legal responsibility for actions. There are different types of psychological disorders: anxiety, mood, dissociative, somatoform, personality, and schizophrenia. There are 3 different types of schizophrenia: catatonic, disorganized, and paranoid. Catatonic schizophrenia is motionless, sudden frenziedness, and holding of contoured postures. Disorganized is incoherent, inappropriate emotional reactions. And paranoid is delusions of persecution or grandeur. Examples of personality disorders are antisocial personality disorder and narcissistic personality disorder. Unit 13, Treatment of Psychopathology. 5 main psychological therapies are used to treat psychopathology: classical psychoanalysis, psychodynamic therapy, humanistic therapies, behavior therapies, and cognitive therapies. There are biological medical treatments which are used to treat pathology. The 3 types are drug therapy, extraconvulsive therapy or ECT, and surgery. Unit 14, Social Psychology. Social cognition refers to the way we interpret and understand social events. Social comparison is comparing selves to the group. Attitudes are stable opinions that affect feelings. Stereotyping are beliefs about people based on their group membership. Prejudice are negative feelings. Attribution is how one explains others' behaviors. And social role theories. Love relationships include romantic and compassionate. Romantic are passionate and obsessive, and compassionate are characterized by trust, caring, and affection. Self-concept, self-esteem, self-consciousness, and self-monitoring and self-perception theory are all parts of the self. Group polarization, social facilitation effect, bystander effect, conformity, and compliance are all part of group dynamics.
The end. Thank you.